Hello, good morning, good afternoon. Welcome to all of the participants and our panelists here today on our latest webinar in a series of webinars all around the cutting edge of collaboration and partnership. And I'm delighted that we have so many people who have registered for this webinar, several hundred people from across the globe. And I'm delighted that we have a fantastic set of panelists all to talk around what is an essential topic around how to create organizations that are institutionally fit for partnering. And this webinar is produced in association with Bond and alongside our colleagues at World Vision and CARE and WFP, all of whom will be on this panel. For those of you who don't know the Partnering Initiative, we are a not-for-profit organization that's been working for nearly 15 years or so now to really try and drive effective collaboration across sectors at scale. And we work at multiple levels. We work at the international policy level. We build platforms for partnership in country. We work with partnerships themselves, helping to build the most effective collaborations and develop the theory and practice of partnering. But one of the areas that has become most important in our work has very much been about what it takes for organizations or institutions to be able to partner well. And our work around this whole concept of organizations becoming institutionally fit for partnering has really come about because we keep hearing the same issues and questions from a variety of different organizations. So some of the things you'll see on your screen right now, we hear things like, well, we use the word partnership for every type of relationship we have, but I'm pretty sure that half of them aren't actually delivering any sort of value. Or we just don't have the pathways to get partnerships to our internal system. It's always an uphill battle. We often hear about the challenges of creating agreements, that we have procurement contracts, but we don't really sort of have standard partnering agreements. Or the issue of lawyers always standing in the way, making it harder and harder for any sort of collaboration or partnership to happen. And more we're seeing this desire to become more of a partner of choice. We understand the absolute need for collaboration, and the challenge is that we're not really set up to deliver it. So the SDGs, we know, require collaboration at very significant scale, but our institutions, our organizations, if they're not set up to be able to deliver it, then we are not going to achieve these goals. So I'm delighted that the panel that we have today is going to really sort of be looking at exactly this issue of what it means for organizations to be institutionally set up to partner effectively. So we have Elizabeth Rambourg from WFP. We have Matt Bannerman from CARE International and Ian de Villiers working with World Vision International. And they're going to be talking about some of their experiences at the global level. And then we're joined by colleagues at the country level who are working to help to make their own offices or national organizations institutionally fit for partnering. So we have Martha Razin from CARE Ethiopia, Doseba Sinai from Wahana Visi Indonesia, so that's the World Vision in Indonesia, and then Eliona Almazi, who's the director of the Western Balkans region in World Vision. But before we get going, I just thought I would introduce just a couple of concepts of how we at TPI have been looking at this concept of fitness for partnering. And we developed a framework that really tried to look in detail at what it takes for an organization to be set up to partner. And this framework really looks at 4 key areas. The first one is around leadership. If you are going to change an organization, if you are going to be much more sort of external facing and always looking to collaborate and partner wherever value can be created, then that really needs to come from the top. You need that permission, that drive, that imperative to partner to come from the top. But of course, you also need the buy-in, the engagement and the skills from below as well. So you have to have both that leadership element alongside the rest of the organization. And what we see alongside leadership is the need to be much more strategic in our partnering. We see too many organizations who partner almost for the sake of it and perhaps are not getting significant value out of their collaborations. So being able to define very clearly how partnership can create value towards delivering an organization's mission is very important to be able to guide the organization and prioritize potential engagement, as is having something of a unique value proposition, understanding where you are in the market, where you are in comparison with other organizations that people might wish to partner with. So understanding what your unique strengths are and why people would want to partner with you is hugely important. Of course, you then need to have the rest of the organization set up to be able to then deliver on whatever the strategy is telling you is the most effective way forward. And what we've seen is that no organization we work with is really optimized to deliver partnering at scale, to mainstream partnering in the way they do their work. So we need to see systems and processes that really are set up to be able to support collaboration. So everything from sort of external engagement, having a very sort of clear communications material that talk about how to partner with us and the value of partnering with us and our partnering principles, and having a clear sort of external liaison person or people who can really sort of engage and be open for those discussions. But also having sort of clear partnering policies and the clear rules and processes that can support the whole life cycle of a partnership, all the way from the initial mapping or systematic approach to mapping the potential partners to create significant value towards your mission. But then also that process of then developing the partnership and assessing the potential value of partnership and all of the due diligence, etc., etc. Then you get to the need for legal agreements that really are set up to be around pro-partnering legal agreements. So, as I said early on, so often we see procurement agreements, but those are really almost destructive of what we want to see in partnership. They instill a power dynamic of a purchaser and a contractor, and so we need to see a change to actually having real partnering agreements. And then, of course, we need this the tracking, the monitoring systems, the relationship management systems in place in order to be able to track multiple leads, multiple existing partnerships, that whole pipeline of partnership development. And it's very rare for an organization to have an effective system in place. In addition, the staff need to have the competencies, the clear skills and mindset for partnering and understanding of other sectors and technical knowledge of partnering in order to be able to drive partnerships efficiently and effectively. And we're seeing a number of organizations building up in addition to building up their staff, but also providing sort of specific expertise or creation of partnering units that can help out staff, as well as the creation of guidance, internal guidance for collaboration to make it much easier to be able to collaborate. And then finally, all of this really has to be underpinned by looking at the culture of an organization. So what do we need to see to be a pro-partnering organization? We do need something of humility to believe and understand that we don't always have the answers ourselves, and that by working with others, we are genuinely able to deliver more. We also need something around creativity and something around risk-taking. So organizations that have very, very low capacity for risk are unlikely to be able to partner effectively, because partnership is necessarily about doing things differently. And whenever you do anything differently, the risk profile absolutely changes. So the whole element of culture and the supportive partnering culture is probably one of the hardest things to instill within an organization. But in the end, you can have all the systems in the world in place, but if you don't have a culture and a desire to use them, then you will not be able to scale up partnering. So typically the way that TPI works with organizations is that we undertake some sort of assessment to look at the current status and look at the degree to which an organization has in place all of these different elements that we see need to be in place to be fit for partnering. We then sort of work with that organization to understand what are the, sort of the key lever points, what are the areas where most improvement can come through potentially small changes or potentially more longer term, harder changes that need to be put in place in that organization. And then go through a period of implementation, which may last anything from a few months to a few years, to really sort of help the organization to adjust and change the way that it works and operates. So we've done this with a variety of different organizations, and we're going to hear from a number of organizations, WFP and Care International and World Vision, who have gone through some parts of this process at different levels. I'd like to start with Elizabeth from WFP to sort of really hear from you about, even though WFP didn't go through the specific full fit for partnering process, but you've done an enormous amount when it comes to building WFP's capacity for partnering. It'd be great to hear something about your experiences.
Well, thank you. My name is Elizabeth Remberger. I work with the World Food Program, and I'm currently in the office of our Assistant Executive Director for Partnerships, who oversees all of our donor relations, government partnerships, but also working with the private sector and the UN. WFP also has a lot of NGO partners, so we run the gamut. As Darian said, I'll take that as a starting point. Whereas we might have not have gone systematically through that fit for partnership process, we've ticked a lot of boxes, and I've been working on this issue for 5 years now, and I see it sort of as an accumulation of action. So I'll give you just an overview of what we did at the high level organizational level to address partnering, which we view as sort of distinct from partnership, how we work with our partners. And so we did something that I think was rather unique. In 2014, we articulated a corporate partnership strategy, and that was for WFP wide, and it was not what we were going to do and achieve with our partners per se on a programmatic level, not those specifics, but it was an aspirational visionary document talking about how we would work with partners. So setting out partnership principles, how we expected to act, what the basis of partnership would be, common interest to shared interest to support our beneficiaries, and a variety of principles in that. And it also included some actions. And when we set out that strategy, we also set up an independent unit called the Partnership Coordination Unit within WFP to specifically work on that. And I started my work with WFP in that team. So I think that was a little unique in that we had the framework and the strategy, and then we had a team, and we were told that we were going to go out there and help our staff partner better. And we weren't responsible for a particular partner group or resource mobilization goal. We were responsible for the act of partnering and bringing people together in different ways. What was the imperative for this? I would say that there's always a positive and negative. I think there was, of course, the macro context of what's happening in the world. Everybody on the panel, and I assume all of our participants are faced with similar complex operating environments, different ways of working, more difficult environments, different ways that we want to work with our partners to get things done and achieve results for our beneficiaries. So there were that demands. Certainly the SDGs, although the strategy predates that. But I'll also be quite frank and say there was sort of a cynical push there too, which was we were told that we weren't partnering well. Our partners told us point blank, you guys could be a little better. You could be nicer to us. You could be a little bit more collaborative. You can include us in program design. And that type of thing. And I'm saying this is all public knowledge because it came through in our evaluations. So if you want to dig deep on our board, you're going to find that. So it was a little push and pull, us wanting to do better, us wanting to kind of be better partners. And the partnership space is competitive. The implementation space is competitive. And we understood that in order to get resources to do our work and to achieve the results that we wanted to, we couldn't do that alone. We had to do it with partners. Thus, this visionary statement. Part of the strategy also included a number of implementation actions. So in addition to setting up that team, we were kind of on call and served a coordinating function to kind of get our act together a bit. But we also provided training, and we've done that on a number of different levels. So we started by given that WFP is a large organization that is decentralized and mostly field-based. We identified focal points and did a series of training the trainer exercises that Darian helped us with. And our idea was that this would trickle down. So we found regional focal points to be champions for the strategy and the concepts, and provided training in partnership, the basics of negotiations and communications, and coordinating some of those generalist skills, and sent them on their way. And then over a couple of years, we counted on them to trickle down this training and found ways to get out to the field to ourselves. And I was kind of a guerrilla group in terms of, in my role in that unit, anytime anybody in my organization started talking about partnership, I would kind of raise my hand and run over and give a little presentation. So found different entry points to embed that in conversations that were already happening. What's happened since then, the strategy has now been not renewed, but incorporated into WFP's strategic plan. So it has formed the bedrock of our strategic plan. We have adopted SDG 17 as one of our strategic objectives. And so in putting out our strategic plan, we have agreed to act in a certain way. And we are always referencing our partnership principles in articulating any strategy. As part of that strategy, we reoriented the way that we worked with countries and in our program design. And to make a long story short, we have tried as much as possible to localize our strategic planning, our program design, whereby country offices, when they are planning their work, are doing that in concert with host governments. And we found that that has been a good avenue and probably a more efficient and logical avenue to seed this as well. So the second wave of training was going to the source, to our country offices, and tying a partnering approach to how people are getting things done. So when country offices are saying, I'm planning on doing X, Y, Z in the next year, we are asking them to incorporate a partnership action plan. In order to achieve this outcome, I'm going to need to work with a partner in this way, and this is planned. So we view those as parallel things, both the what and the how we work with others. So I would say that's kind of phase 2 of how we worked. And I'll finalize this quickly because I want to leave a lot of room for discussion in the other panelists. I think we'll come back and flesh out a lot of these points. Darren, you asked me to mention the newest thing that we're doing, which is a partnership competency analysis. So WFP, as I mentioned, we have a strategy, we had a unit, we have a dedicated department, we have all these things. We have a partnership function. So we have logistics officers, nutrition officers, and we have partnership officers. So you would think it would be very clear. I am a partnership officer, and this is what I do and how I get my job done. But we recognize that there's still a lot of confusion of what does it mean to partner in today's context. And we didn't always have the right people in the right place with the right set of sort of skills and understanding of complexity to do a given job. So if you're a private sector officer working in Rome, you need one set of skills. If you are responsible for the DFID relationship, you need to be able to navigate a pretty complex British political environment. So there are different things, different competencies, and we have a lot of partnership officers that have been doing this a lot of time, for a long time, that are still thinking about partnership as, hey, it's resource mobilization, I need to process grants, or I need to ask for money, or I'm an implementation officer in the field, I'm just talking to my NGO and telling them what needs to get done. There's a whole new level of complexity, and we're asking our partnership officers to navigate worlds and work with partners in a different way. So yes, you're implementing, yes, you're doing the paperwork, but you're also assessing the political landscape, you're doing advocacy work, you're being a convener. And we haven't quite really defined this. So we're taking a step back right now and completely rehauling our career framework and defining what skills are needed to get the job done now. And what that will include is a series of one-on-one interviews with our staff around the field to assess their behaviors. What's your day-to-day job? What are the actual processes and things that you're doing? What's demanded of you? And then having some workshops with our leadership. And from that, what we hope to get out of it is an idea of what's needed, what the priorities are for us as an organization. Is it advocacy? Is it communications? Is it political savvy? And then look at the gap. And that will help us better articulate to our staff what we want, provide them the training that they need, and also hopefully attract people to this field. I want to end by saying that I've worked for the past 5 years on this, from the visionary part down to this more concrete stuff. But it hasn't really become tangible to our staff until we've tied it to something very specific, whether that is the country planning process. And then we're able to say, what we're talking about is how you work with these people. Or the very specifics of the job descriptions. You really need to show staff what it's for and solve a problem for them and help them be creative for this stuff to stick, from my perspective. So thank you, and I look forward to the other panelists.
Wonderful, thank you very much, Elizabeth. And I think what's really interesting is your approach. So you started off by kind of doing a major push. You know, you created this partnership coordination unit, which sort of sits at the HQ level to sort of get everything going. There's a strategy, then it's beginning to put in place the strategy, but then it's really about integrating at the country level and trying to integrate partnerships into the annual planning or whatever the planning process is at the country level. But also, I really liked the way that you're talking about the need for this to become real to staff. This has got to be about their job, their works, and then the specific competencies that they need. So in the end, you're basically trying to, yes, you might start off with a partnering unit, but in the end, you're trying to just basically integrate this out so that it clearly becomes everybody's job, everybody's role in partnering. Brilliant. Thank you very much indeed. Matt Bannerman from CARE International. Tell me how much of what Elizabeth said, how does that resonate with you, and what have been your experiences when it comes to building CARE's ability to partner more effectively?
Sure, thanks, Darian. And a lot of what Elizabeth says kind of mirrors our experience, although I think there are some differences as well. CARE is, of course, international NGO, very different kind of organization, although working in many similar areas. Apologies, by the way, everyone, that you don't have a nice moving picture of me. That's a technical hitch entirely at my end, not Darian's. And apologies too, I'm battling with a heavy cold at the moment, so if you can't hear me particularly well, that's the reason, but let me do my best. So we have certainly within CARE been on a partnering journey. We've been partnering, using those air quotes, for certainly as long as I've been with the organization, which is a dozen years. now, from all aspects of our program, from the emergency side, humanitarian programming that CARE does, right through to the longer term poverty fighting, development, governance, gender equality work that CARE is also known for. But certainly for most of that time, we've had a pretty kind of traditional sense of and a pretty limited sense of what partnering actually meant. And a lot of that ultimately was about finding people to implement our programs. So, launching processes whereby we would identify partner organizations who we would then kind of transfer resources or transfer capacity, again in air quotes, to, so that the things that CARE and ultimately its donors and other stakeholders wanted to happen would happen. And I think that led to quite a kind of compliance focused idea of the partnering relationship. There's one country in the region in which I work where CARE became known as the care of 1,000 papers, because of our reputation of coming with yet another form that people had to fill in to make sure that all the I's were dotted and the T's were crossed, and that we were fulfilling all the compliance requirements without ever really getting into a kind of strategic conversation. I remember when I first took up a position in a country office, we worked with a range of partners, but the tradition there was very much that we would summon them all on an annual basis to attend a meeting at our offices, rather than going out to meet them in the places where they were headquartered and based in the capital city and beyond, which again just illustrates a particular kind of power dynamic, which I think a number of us struggle with when it comes to partnerships. This has changed and is changing quite profoundly, I think. And partly through some of the big strategic drivers behind the SDGs, behind CARE's own new corporate strategy, and a number of other organizations. Things like, for example, the fact that most poor people now live in middle-income countries, that most people, full stop, now live in cities, so that some of those people are connected in ways that are completely different and kind of move far beyond any idea that there could be kind of linear chain of resources and expertise flowing from one part of the world to another. Inequality is now a central issue, meaning that more than ever, development and the battle against poverty is a political issue, which is about mobilizing different coalitions and actors. It's not, in as much as it ever was, a technical issue about transfer of resources and knowledge. So all this means that CARE has, you might say slowly, but definitely come to the realization that to create real change, we need to be working through and with coalitions of stakeholders and actors that are essentially political and about the way that power is organized and decisions are made that affect poor people's lives. And in order to do that, we need to completely rethink the way that we partner with those organizations. Our partners and the kind of partners that we're looking for are much more vociferous, much more sure of the way that they want to implement their agenda. They may be organized in completely different ways. They may be expecting completely different things from us, and certainly our ability to listen and engage in conversations that are much more structural, much more strategic, and much less about simply how we get the things that are in the log frame done. That is essentially our kind of new partnership agenda. So how do we tackle that? Well, again, I think the framework that Darian's laid out is very helpful. Clearly, it starts with leadership and culture, being able to explain what partnership means along the lines that I just have, rather than the much more instrumentalist version that I think has been common in a lot of our organizations hitherto. But also, I think this was really at the root of our beginning to explore a relationship with a group like the Partnering Initiative, TPI, was this idea that partnering is also a skill set. It's something that can be understood, something that can be built up and learned and explored and developed with our staff and with our teams around the world. And that's really what lay behind designing, as we did, a program with TPI to begin to develop those partnering skills, those skills around listening and brokering and searching for shared value, which we ran over 6 months between January and June last year. It was essentially the fit for partnering approach that many of you will be familiar with. What we decided early on in the process is that we didn't want to do that process to our country teams. CARE is, like WFP, a very decentralized organization. We wanted the country teams themselves to be driving that process of research and understanding the partnership and partnering landscape. And so we set up a process with TPI, and Darian and his team very flexible and helped us, or we kind of co-designed this with them, which was really about working with a group of partnership champions, about 15 people from across our East Central Southern Africa region, who would then apply the fit for partnering kind of lens to their context and come to a conclusion about what the key breakthroughs that we needed to make in each of the contexts were. So we set up a system which included a kind of online assessment, initially some webinars with some of the TPI expert colleagues, peer support with some action learning groups, and then one kind of face-to-face training and workshopping event, really to try and get to a point where those partnering champions in each of our offices and country programs were able to present to their country senior management teams a very clear partnering agenda. These are the things that we need to move forward in our context if we're going to really lean into this different sense of what partnering means. And I think we'll hear a bit from one of those country teams and from my colleague Martha in a second about how that's landed and how we've been able to move forward with that in one particular context in Ethiopia. But let me stop there, Darian, because I know there's lots more to cram in.
Thank you very much, Matt. And I think what's really going to be very interesting is hearing the slightly difference in approach that CARE International took and World Vision has taken. So in the case of CARE International, it was done very much through almost like a community of practice of champions in each of the country office going through a process together to really sort of develop the fit for partnering analysis of each of the country offices, as well as simultaneously building their capacity for partnering, but also trying to develop through peer exchange the sort of capacity for building change within each of the country office. And then we'll hear now from Ian about the slightly different approach that World Vision has taken to do similar sort of thing, but sort of more on a one-by-one country office level. With that, over to you, Ian.
Thank you. It's great, and I'm really enjoying what I'm hearing. I'm going to be very brief. First, from our global perspective, World Vision has articulated into our global strategy that we have a desire to collaborate for greater impact, because we recognize very clearly that we just cannot get to the kind of impact on children's well-being that we would like to alone, very much as Matt has been describing. And with that, we've been doing lots and lots of partnering for many years, but I think what became clear is that there was a need to move from, if you like, incremental, very often transactional, and very often just funded partnerships where you have just little progress, and we needed to move that to much more transformational, much more equitable partnerships that could get to the kind of scale of change that is needed, and where we need to get much cleverer as well. Instead of essentially paying people to be our partners, how we are able to take a clear value proposition about how we might work with organizations from across society to make the difference that we would like to. So those are some of the driving needs. A large NGO, of course, has got, we can do a test with CARE who had the most papers at some other time, but certainly what partners were often saying is, in terms of your vision and in terms of your people, it's fantastic, but actually as an organization, you're not always very easy to adapt to, and we're certainly not always getting a sense that you want to adapt to us, even though you listen, your people are great, we love to work with you. How can we make that all simpler? So those are some of the driving kind of things that we are expecting to see change. And then the other thing is simply recognizing that we have got very, very different contexts. So we have fragile contexts where we are doing remote partnering. We don't have that represented on the call today. Then we have middle-income countries like Indonesia, where the landscape is changing. And then more of those transitioning economies, such as in the West Balkans, where the footprint and the role of an international NGO, again, is going to be very different. And so what we're doing at the moment is really checking out this process, identifying what's going to be the same, but also what's going to be different. And then the next thing to do will be to grow that kind of internal community practice and find out how do we scale this across the different countries. So that's kind of where we're up to. And yeah, I think let's move on and hear more from our national office leaders from CARE and World Vision.
Thank you very much, Ian. It sounds there's across all three organisations there are a similar set of drivers for this in terms of the changing nature of international development as a whole, and then somewhat different responses then to then build up the organisations. So going down to the country level, and it'd be good to hear from you, Martha, about your experiences with CARE in Ethiopia. How has it been in terms of sort of trying to make this organizational adjustment, the organizational change in your country?
Hi, everyone. I'm Martha, working as a partnership and capacity building advisor for CARE Ethiopia. I've been in this position for the last 5-6 years. But like already said, I feel that I don't even understand what partnership is. The real partnership is after taking the TPI partnership training. It was really amazing. I really want to thank CARE for this opportunity and TPI for such a wonderful and unique experience. So in CARE Ethiopia, we have been working with NGOs, mostly with local NGOs. We get some grants from donors and we sub-grant. So mainly we were like either in a consortium as a sub or providing some grants to local NGOs. I would say that we didn't have that much diversified partnership type, like working private sectors with research institutes, but recently, we're trying to look partnership from a bigger picture. And it's not only having Martha or somebody, a focal person that makes an organization successful in partnering. So we now have understood, especially after the TPI for partnering training, me, myself, and also my organization, CARE Ethiopia, has well understood that we need to shift our minds. So we need to be working towards becoming a fit for partnering organizations. So immediately after the training from Nairobi, after the Fit for Partnering workshop and training, what I tried as a champion trained in this training was trying to share what I have been learning from immediately, I think it was in 2 weeks' time after the training, I immediately take advantage of sharing in a very senior staff biannual meeting where we try to create awareness and also try to motivate people to be partnership champions. So everybody was made to wear this green ribbon. So in Care Ethiopia, green ribbon is a symbol of partnership, becoming a good partnering organization. What I personally also did after the training is we have a partnership strategy. When I look at it, it was totally different from what I have learned. So now we are on the way to revise that strategy to incorporate the very elements of real partnership that will make us to become a partner of choice, because Care International's vision is to be a partner of choice worldwide to eradicate poverty. So we're working towards that, and also our, like Matt said, our impact strategy, everything. We know that globally we're known working in gender equality and also women empowerment, but without partnership, now we saying that this is impossible. Any special focus area for any partner, if we need to be very successful, be it in climate change, be it in gender equality, be it in women empowerment, we need to work with partners. We need to be on the real partner journey.
What would you say is the one biggest change that you can make in your office in order to support you to be fit for partnering? Biggest change you think that's needed?
That's the mindset. We need to, we are very traditional. The organizational culture is still a challenge. It will continue a challenge. So we need to do on the 4 strategic elements of organizational capacity. We know the leadership and the strategy. We need to work on staff competency. We have staff, but most of them, including myself previously, we are not that good at partnership. We just think that we know partnership, but it is not the way we are. That is what we observed from the survey also. The survey gave us to look into ourselves and also the perspective what other partners, because it was also conducted we tried to see it from our partners' perspective. So now we have tried to look at ourselves and also from others' perspective. So we need to work on our mindset. There need to be shift, transforming the way we're doing things. We need to have systems and processes in place. We need to have a competent staff. But which comes first, and prioritizing is the issue, and we need budget on that. Without budget, I don't think that we can. Of course, we can integrate, but for integration also we need budget. So the focus, the commitment, there is a commitment in the leadership, but that has to be action-oriented and continued, consistent. That's what I can say.
Wonderful, thank you very much indeed. And our colleague Matt is going to have to leave us in just a moment. Matt, can you just comment across the care offices whether Marta's experience is the sort of a common one, that mindset is clearly hugely important here, as well as the strategy?
In a word, yes, Darian, absolutely. And I think, I mean, it connects with actually the point Elizabeth was addressing earlier about, you know, we all work in organizations that have high levels of staff turnover, particularly in some of the more challenging contexts, and that is exactly where this idea of culture and mindset, supported by, you know, some really clear leadership, is so important, because where you've got new people coming into the team the whole time, so often coming from organizations which might not be putting such an emphasis on partnering and partnership skills, you know, it's really important to indoctrinate them early. We now, you know, we look for partnership skills now in our recruitment. We emphasize them in our induction. We provide regular refreshment training, and we use all kinds of different feedback tools, as has already been mentioned, to keep checking back on kind of how we're doing. But I do agree with Marta, absolutely. I think that culture and mindset of listening, of being respectful, of looking together for the value that can come from different sorts of organizations working together is the key shift. Yeah.
Great, thank you very much indeed. And Pak Ote, you are the head of World Vision in Indonesia. The leadership, that's you. So you are the one that we're hearing the importance of leadership, and I know that you have really picked up and are running with this partnering agenda. What's been your experiences in terms of this shift that you're needing to make within the organization?
Okay, thank you, Darian. Hello, everybody. I'm Dose Basinai from Wahana Vision Indonesia, the partner of World Vision in Indonesia right now. So, from Indonesia's perspective, first of all, I would like to appreciate all the input from the panelists. What I want to highlight is the type of partnering that we have and how we started. For the Indonesia, right now we grouping our partnering into 4 groups, and this is defined by the main partner. The first one is the government group. This is where we approaching government and developing the partnership. And then the number 2 is corporate or corporation, the private sector group. And number 3 is the church and faith-based organization. And the last one is with other NGOs. When I said the main partner, we also experience that stick to the main partner actually is the starting point. Because as you go along with the partnering, then we can see that the doors are open, other partnering would like to join, and then with our knowledge and networks, we actually can invite more people into the partnering. But again, we define that into who are the first main partners. So we start from there. And I think about the overall implementation in Indonesia, I would like to appreciate Ian from World Vision International as a senior advisor that starting this process more than 2 years, around 2 years ago. And also we appreciate the partnering initiative, TPI, with this approach of fit for partnering when we start to do the assessment at the beginning of how we are in our strategy, how we are in our system, how we are in the staff and culture. I think that's the key. That's mapping at the beginning. The baseline is actually something that we can work on. If we know where our blind spot, our area for development, then we can develop the strategy for the improving the partnering. So I think that's the story we have. One key learning that I would like to share at this part is actually the partnering is a journey. We experience that. We know that this is the one we have partnered, the more lessons we have for them. And at this point, I think for Indonesia, we have trained the people who are coming in, and then I think we still at what we said, the quantity partner. I mean, the more we have partnering, the more we see the organization capacity growing. But we understand that in the future, as we go along, we want to move from this quantity partnering into the quality partnering. This means we will reduce the number of partners, but we want to be the one with the strategic shared values, strategic objective, and organization that we can grow together in achieving the shared vision and mission together. Thank you.
Thank you very much indeed. And I think this need to be very strategic in the types of partnership and who you partner with is becoming more and more essential given the limited time and resources. And some of the questions that we had here in the Q&A were around this limited time we have for partnering, which means that we really need to be focusing only on those partnerships we know are going to create significant value for our organization or delivering our organizational mission, because we just don't have the time to be pursuing every partnership need. Eliona, coming to you and your experiences in the Balkans, what would you add to what you've heard from other colleagues?
Well, Darian, I would say pretty much we heard the most important things, and I would echo most, if not everything, that my colleagues mentioned before. I guess with the Western Balkans, what happened is that we made the choice to become a partner of choice. So that's very important. I think that's the very first key success factor. And we made the SDG 17, not just for our global strategy, but also for the national strategies to be a strategic direction. That's the very first most important thing to mention. And the Partnering Initiative program came at a very good timing for us, I must say. We went through a process that sharpened our thinking around partnering. We did a very deep assessment on where we were in our partnering competencies. We formulated our action plans and we tied them with our strategies in the country offices in the Western Balkans. And now we are under implementation, and we have some examples where the tools that we got in the program were very handy, like the partnership health check tool or the negotiation skills that we learned in the program, and furthermore. Now, if I were to distinguish what are the things that really make us stand out in being a partner of choice is, first of all, the courage. You mentioned at the beginning of this webinar that we have to take risks. And if we don't take some decisions, and if we don't show the bravery and the courage to go ahead and interact with the other partner organizations and the institutions, then nothing is going to happen. And those very hard, complex vulnerabilities and issues around the globe are not going to be addressed properly. So the courage to take the risk internally, meaning those people around us here in the team that go out and create the relationships, they are crucial. Second is also the courage found from external partners, those that we want to partner with. And it's those people who embrace very courageously the commitment of the partnership, because it makes a difference. In a region or in a sub-region like ours, where there are countries like Bosnia and Herzegovina or Kosovo or Albania that have been through so much tough pasts, the distrust in the society is really high. So you got to tackle that when you build the partnership. And when you find committed partners, it really makes a difference and it builds on the trust. So I would really distinguish those critical success factors. But then on the other hand, I must say we also face the challenges. And one of the challenges is that when you are an international organization and when you want to partner with local organizations, there is this discrepancy between the agility that the local organizations have and the bureaucracy and the hard moving machinery that the international organizations have. So there is a clash there. And when we experience that clash, that's when one of the steps that we learned in the program, which is around the building the effective and principled negotiation, that comes in very handy to sit down and to understand where do each of the partners come from, and try to understand each other better. And then one other thing which I think it makes a difference is to own your value proposition, to own it, to really own it, to have confidence in it. And when you go out on the table, you don't have a hidden agenda, but you show what is really important to you and what you are really good at. So that makes a difference, I say. Now, as a leader, what I've learned is that if I don't spend time with my team to really, truly understand and to really make partnership the agenda, or our topic in the agenda, then not much is going to happen. So this is the learning that I wanted to share, but of course, we can deepen more anytime. Thank you so much for the opportunity to speak here.
Thank you so much, and thank you very much for all your rich examples here. So I think we've heard from across the panels the whole gamut, the whole variety of elements that really need to be in place. Everything from the mindset to the skills and competencies, to the leadership, to the systems. All the things we started with have come through clearly very strongly here. The way that we will round up this webinar is I'd like each of our panelists to please give one piece of advice, the most important piece of advice to anyone wishing to really sort of change their organization to become more fit for partnering. What is the one thing that you would suggest to them based on your experiences? Over to you, Martha.
A lot of factors, but one thing I want to emphasize is to have the interest for change and also the commitment at all levels, especially at the leadership level.
The commitment at all levels. Thank you very much indeed. I think Ian was next on that.
It's only going to happen if the senior leaders own it and model it. And that means that they have to accept there's messiness, adapting, flexibility. But if they model that in their partnering practice, the organization will follow.
Modeling the practice of partnering with the leader. I like that. Thank you. Faculty.
Yeah. Yeah, I think given the culture in Indonesia, I would like to say that in partnering and build trust with the partner, I think we should be not only open mind, but also open heart. Thank you.
Wonderful. Great expression, both open-minded and open-hearted. Elizabeth.
I would say, I guess, time and an intention. No matter what you do, partnership takes time. And if leaders haven't acknowledged that and modeled that and enabled their staff to do all the partnering things, have the meetings as part of their work. Partnering is part of your job. So the bottom line is not just number of people served or amount of dollars into the organization, but the relationships that you're forging. It's just not going to happen.
Thank you very much indeed. Yes, the need to actually invest to allow people the time and the freedom to be able to go out and partner. That always comes up as the #1 challenge that we see from partnership practitioners, as they feel they're never given that sufficient time to really be able to develop these effective partnerships. Eliona, what's your one piece of advice?
Whenever you make the choice to be fit for partnering, remember that you are part of a bigger thing here, and you are also helping other organizations to be fit for partnering.
Wonderful. I love that idea that the way that you do this, the way that you work within your own organization, can also help to be contagious, and supporting other organizations, your partners around you, themselves to build their ability to be fit for partnering. With that, thank you all very much indeed, and very much look forward to seeing you at the next webinar in our series. Thank you. Bye-bye.